A wave of RSV spreading across the country, and infant hospitalizations are now rising.
Yeah, California hospitals are not seeing a big surge, but local health officials are urging vaccinations for babies and pregnant women. Joining us now, Dr. David Bronstein, a pediatric infectious disease specialist at Kaiser Permanente, Antelope Valley. Thank you so much for being with us this morning.
Thank you. Good morning.
Good morning.
So let's talk about this RSV. We've heard about it the last couple years. It's really bad for young children, but it's also bad for the elderly, which a lot of times grandma and grandpa are the ones watching the babies, right? And helping babysit. So can you tell us who's most at risk and why they're at risk and what can be done?
Yeah, no, as a pediatrician, I've always thought about it for the young kids, and it definitely is very bad for infants. So when we think of infants, especially those under 6 months of age, very serious. So for us, it's a cold.
Right.
Okay.
But for an infant, it causes something called bronchiolitis, where it goes down into the small airways of the lungs and makes infants who don't have any other medical history, don't have histories of asthma, but they start wheezing. They start acting like kids with asthma, and there's not much you can do for it. And so we wind up filling our hospitals with these poor kids that are wheezing and just waiting for them to get better. It's really frustrating. But even though we always think of it for kids, like you said, elderly folks are at high risk too.
Right.
And we don't always appreciate that. 10,000 people per year die from RSV.
Really?
And so much of that now, especially with the new vaccine, is preventable.
Okay.
Okay, well, that's at least the good side of it. The bad thing is we could see a triple-demic this season because we're not just talking about RSV. We also have flu and COVID. So what are the differences and how do parents and people even know if you're showing symptoms, which one is which? I think we always have that struggle.
Yeah.
We're like, you're sick, but what kind of sick?
Yeah, so it's hard to know. And to a certain extent, it doesn't matter too much, just because if you're sick enough where you need medical attention, yeah, we can test for it, but there's not a lot in terms of treatments that we do. Yes, there's antivirals for flu especially, but for RSV, there really isn't, and it's more just that supportive care. So testing is important, but the goal is to prevent against all three of those, and now luckily we're able to do that with the immunizations that we have.
Well, talk about that a little bit because you have specific recommendations for people when it comes to those vaccinations.
Yeah, so for infants, to me, again, as a pediatrician, that's the most important thing. And the great part is you can immunize mom when she's pregnant. So you give the vaccine to mom when she's 32 to 36 weeks pregnant, and that will give her the antibodies that she then passes on to protect the infant. Now, if mom doesn't get the vaccine because either the timing's off or one thing happens or another thing happens and you just don't get it, that's okay. You can still protect the baby, and we have immunization specifically for kids 8 months of age and younger. And so we can definitely immunize the baby, give them that same good protection. For elderly folks, those over 75, it's recommended that everyone gets the RSV vaccine.
Oh.
And for people 50 and up, if you have high-risk conditions. So people who have cardiovascular disease, chronic lung disease, kidney disease, those who are immunosuppressed or living in nursing homes, long-term care facilities, a number of folks, almost feels like almost everybody in some way is high risk.
Right.
And so we want to make sure that we're protecting them as well, because again, it's not just a common cold for them.
Right.
It will cause pneumonia, bronchiolitis, and all those other scary things that we can now prevent.
And protection is available.
Yes.
All right, well, thank you for
Absolutely.
being with us, Dr. Bronstein.
Also, just got to mention that tie is pretty great.
Yeah,
I like that we're keeping the celebration going.
Let them see the tie.
Three-peat, doctor?
I think so.
Thank you. The doctor's orders. It's 7:39 now. Thank you.